What inspired you to transition from your traditional healthcare role to becoming a digital health innovator, whether fully or partly? And what challenges have you faced during this transition? This question is going to help a lot of participants on this call as to find their why for entering into the digital health domain.
I guess it's one of those stories where it's not a case where I left medical school thinking, oh my God, I'm going to go into digital health. It wasn't that. I mean, I finished medical school quite a bit ago, like almost, I think about 9 years now. It's been a while. But my transition, I would say, first of all, when it comes to even talking about traditional medicine, which is mostly clinical care, as you know it, and potentially public health, the traditional specialties that you would normally do. I think when it comes to transitioning and just to help people, I would say that as I talk about my journey, I would also say, I would talk about the different things that were going through my head, right? So that in case any of us are feeling like, is this really right for me and all? The first thing about transitioning is that you have to be open to change. You have to be open to sort of listening to yourself and listening to the things that that draws your attention, right? So yeah, so I mean, from traditional clinical medicine, I served right from school. I thought I was going to be a psychiatrist, right? Funny story. I thought I was going to be a psychiatrist. On my first, I think one of my very first as a student, we went to Yaba Psychiatric. I was enjoying it till we were clerking a patient and the patient just attacked us. So first of all, I ditched that. Like, I never thought in my head that a patient can attack you while you are trying to collect them or provide care. So that seemed quite threatening. And so I left medical school. Of course, I served and all. And I then went into clinical care. So I was an MO, I think at the time it was for Critical Rescue International. And I would say that my transition kind of started from there in a way, in terms of very not from traditional medicine. So it's also a personality type. I'm also the kind of person that I get bored easily, I would say. So when patients come, when they come, it feels like, oh my God, this problem, they've never heard of it before, or this problem is really special. But as a medical officer, you've probably seen like 6 or 7 or even 10, depending on how the clinic day is, right? You've probably seen it. So I found it quite repetitive. I was more interested in why the system was not working. Why is it that patients have to stay for so long? Why is it that we don't have as many healthcare workers to attend to patients? So I've always been a system person. I was more interested in those things. And I was pretty bold. So I would challenge management to say, oh, sir, why can't we do this way? Why can't we do that way? So that was kind of, and when I realized, and since they saw that I was interested in the process of things, they were involving me. They were involving me in more things. Can you hear me?
Yes.
Yeah. Okay. They
Yes,
were
we're tired,
involving
yeah.
me. Yeah, they were involving me in more things, and hence then that was what led me into sort of public health. But by the time I wrote my personal statements, they were like, Nigeria needs more of a primary healthcare system than public health. So they then sent my credentials to primary healthcare. And, so that kind of moved me away from, sort of, I would say, like the traditional way of doing things. I worked in an HMO, and then I moved into public health proper, where I've worked on a couple of projects. But one of the times I was working with private facilities, about 75 private facilities at the time in networks, and trying to strengthen them. And one of the solutions that we implemented was an electronic medical record system. So that was sort of my very first engagement with digital health, right? trying to institute it, the process, trying to get people through the change management process. So I found it interesting. And also because for years we've been, supported by a lot of developmental partners, right? The BMGFs and all these great development partners. I've worked on several projects, but then I realized that we keep training individuals, we keep training, building capacity, strengthening the hospitals, and also providing advisory to government people. But then 2 years after, you find out that the same type of project, another developmental partner will fund that kind of project. So it felt like you train, sometimes they post the healthcare worker outside of the facility, and then either another project, and you have to start again. And so for me, I got to a point in my career when I felt like it is preferable to invest in a system, right? And then as opposed to people, like invest in a system and you train people around that system. And one of the things was, digital health. When you invest in digital health, you are building, a digital version of a system, and then you can train people around that system in such a way that even if the champion leaves, they don't take all the institutional knowledge and go. And so for me, that was really the attraction to move into digital health, right? To build systems that would outlast people, and then the systems that will also learn how people behave and make the processes more efficient for healthcare workers. And so that was how I kind of then ventured into digital health. The main challenge, I think, and I'll just take it from a professional point of view. One is that as a digital health expert, is first of all understanding that there are various areas to it. It is still what I'll call sort of a profession or an angle that is still developing, right? So the challenge is you may not really, if you are not a core technical, like a software developer, you may not really understand how would you grow? Like what does the future look like? Because it's still a developing thing. Another major challenge could be you also trying to benchmark yourself with people in traditional care. Because if you're an alumni group, for example, when you are done with junior residency, you are going to senior residency. And that pathway may not be that straightforward. So you just need to be bold and keep learning and keep doing courses and stuff too. And so it's really the uncertainty about it, right? But also at the back of your mind is also the opportunities and the ability to evolve with digital health. Yeah.